Okay. All right, we've got another caller waiting. Marie, good evening and welcome to the program. You're on the air.
Hi.
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 I had a question. I was born with scoliosis.
Okay.
And my mom didn't want to get the surgery because she was scared that it would leave me alive.
Right.
And I didn't have children. And I didn't have epidurals. And they think arthritis is starting to show in my back. Would that cause degenerated disc?
Well, with patients who have a scoliotic type of a curve, very often that curve will actually, over time, because it's not moving properly, start to cause the bones to wear a little bit, and that'll cause the discs to wear out a little bit. And so what happens is we do start to see degenerative changes associated with that. As far as scoliosis, it's kind of an interesting not only diagnosis but process, because as time goes on, as you get older, that scoliotic curve is going to get worse. And so, go ahead, I'm sorry.
No, I was just commenting on it. And like I work in a factory, and I use my hands a lot, and while I'm working, I feel sharp pains like in my back and in my legs, and I just work through it, but I don't feel it in my hands. But then when I get home, like my hands feel like they're swollen, like that. You get what I'm saying?
I
when
understand.
I wake up in the morning, everything hurts. I got to make myself get up.
Right. No,
I'll be cool through the day.
I understand that. It's not good, and a lot of that's just as a result of the inflammation and the irritation to those nerves. You know, from the standpoint of what you can do for that, there are some stretches that you can do. There are some other things that you can do conservatively from not only a treatment standpoint, but in a bracing to help with the scoliosis. But most of that pain is a result of the improper movement, and along with that, it is something that from a conservative chiropractic standpoint, it has been treated, scoliosis has been treated by chiropractors for years. There are varying degrees of improvement that they can get with that based on the patient's age, activity level, and the amount of degeneration that's present. So that may be an idea for you.
Okay, very good. We've got another caller waiting. Kathy, good evening and welcome to the program. You're on the air. Hello, Kathy? Hello.
Hi.
Hi.
Hi, Kathy.
Yes, hi. I have degenerative disc disease.
Okay.
And I also had sciatic pain, and it was so bad I went to the hospital. They gave me a epidural, and I was allergic to the injection.
Right.
And so they had I went into cardiac arrest.
Oh my goodness.
And they ended up doing surgery, and they found a tumor.
Okay.
And they took that out. And then on the other side of my back, they did pins and screws, you know, to fix it. I'm still having pain in my left leg. I stumble or, you know, can't walk right. And I don't know. I've never been to a chiropractor.
So you're just wondering what your next step should be, huh?
Yes,
Yeah.
yes. And I did get that test done.
Like a conduction test?
It was, they said, yes.
Okay. Well, a lot of this is going to depend on, first of all, how long ago was the surgery?
Close to a year.
Okay. Have you seen the surgeon who performed the surgery?
Yes.
Since then? And as far as treatment, have they done anything else since your surgery?
No.
Okay.
They just gave me pain medicine.
Okay.
And that's like putting a Band-Aid.
It is, and at the same time, what you're talking about is something that's very serious. You had not only had a disc-related problem, but you also ended up having a tumor along with that, and now it sounds like you have a fusion in your spine. Those things complicate factors dramatically, and they make things more difficult to treat. It may be a situation that you want to talk with your surgeon prior to seeking chiropractic care, just based on the multitude of things that you have going on. Okay?
All right. We have another caller waiting.
Okay,
Rick,
great.
good evening and welcome to our program. You're on the air.
Hi, hello.
Hi.
I've got the question I've got is I've had 3 back surgeries. I've had one of the top part of my back, and I've had 2 lower back surgeries.
Okay.
And here a few months ago, I experienced a lot of it was like my legs. It started out in my knees. They just felt like they were going to sleep, and it went down into my feet. And about, I don't know, it was like maybe half a day later, it had worked its way up to where, all the way up into my hips, to where it was, everything was just, it was, I mean, I could walk, but
hey, Rick,
it was so,
hey, Rick, can I ask you a quick question?
Yeah.
As far as the surgeries, what did they fuse your spine together, or did they just go in and cut off a portion of the disc, or what did they do?
Well, my neck, they done a fusion on that.
Okay.
And then on the lower ones, they had to do a lot of removing on the disc.
Okay. Go ahead.
Go ahead.
What I was going to say is, when it comes to surgery, actually we're talking about 2 different parts of the spine, and certainly what's going on in your neck can affect your lower extremities as well. As far as those types of procedures are concerned, when we deal with a fusion, they work to immobilize a portion of your spine, and as they do that, what we start to see happen very often is the degeneration, because the wear and tear, the movement that normally would have taken place at that disc level has to go someplace else. So very often it actually goes to the adjacent level. It goes above and below, and we start to see problems developing from those disc levels. So when they fused it together, they stopped that area, and that part of your spine isn't going to necessarily cause pain or a problem. It's the levels that are around it that do. And so as a result of that, that can take place in both your neck or your lower back, or both. And so what happens is we don't know exactly, without doing a complete and thorough examination, exactly where the problem is coming from and exactly where the pain is coming from.
Okay. See, I know on my left leg, there's that sciatic nerve. It affects that too. And
Right.
I've been to a doctor over that, but
Okay.
I haven't really gotten any good answers yet.
Yeah.
You know, Rick, when we talk about this type of a problem, I think probably the best thing to do is to make sure that the doctor that you see for this problem going forward does a thorough physical examination and make sure he does a very good case history on you. Very often, as a result of a lot of the different imaging studies that are available, you know, you go into a doctor's office and they say, well, I'll tell you what, you've got sciatic pain, or you've got back pain, or leg pain, and we start to see that, well, the first thing that they do is they order an MRI. Really, the most important thing I think for them to do is to do a thorough examination before they do that, so that we can figure out exactly what the problem is, and then from there make the proper suggestions as far as imaging studies.
Okay. Now, I wanted to mention you brought some books along with you. We've got about a minute
Yes,
left. Tell us about these books, Dr.
Yes,
Busch.
I did. Well, actually, I'll tell you what. Here you go, Liz. This is a copy of my new book. It's called Surgery Not Included: Freedom from Chronic Neck and Back Pain. Okay.
Okay.
It is available on our website at buschchiropractic.com. We have several different offers available. There's a little bit of a bonus offer there. If you do that, we've got the first chapter is done as an audiobook as well.
Okay.
And so there are some other things available there also.
Okay. And in this book, you will explain to people a lot of what we've talked about tonight on the show, and probably a lot more, right?
Exactly. We talk about not only what the causes of these types of problems are, but also we give stories about a lot of our patients who have been through these types of the type of pain. I found it very interesting the way that the patients have actually responded to it. They've been very open to it, and a lot of them can see themselves in the patients that we talk about.
Okay, very good. Dr. Richard Busch, thank you very much. It was a quick half hour.
Hey, thank you very much.
Thank you for being
time.
here, and thank you for joining us for this edition of Docs on Call. I hope you'll be here again next week on Tuesday night at 7:30. Dr. Stephen Hatch and Dr. David Bodrab will be here to talk about pain management. Until then, I'm Liz Schatzline. Thanks for watching. Good night.